patient and ask him, get a quick medical history, ask him if he's allergic to any medication, latex, shellfish, dyes. Explain to him briefly what you're going to be doing. You're going to be injecting dye into his hand, so, you know, the dye will travel up, and so you can visualize the vasculature in the back of the eye. Okay. Next, you'll want to draw up the medication. You want to check that it's fluorescein and the expiration date. This is June 14th. These will be in the paper wrappers, so you'll just, you know, open them up. You don't want either end of these to touch anything. They need to remain sterile. Twist it together. Oops, I opened two. Clean the top of the bottle off. You want 3 cc's of fluorescein, so you're going to pull back a little more than 3 cc's of air. Put it into the bottle without securing the bottle like this. Inject the air, and then pull back. If you get a lot of air, you can just push it back in. Pull back to a little bit more than 3 cc's. You're going to hold the barrel securely and flick so all the air bubbles rise to the top. And you're going to push up to the 3. You're going to measure it by the top black line. There's a bump or a meniscus. You don't want to measure by that, just the top of the line. Then you're going to scoop the top back on. They don't want you going like this. You may stick yourself. And you can secure it like this. Then you're going to draw up the epinephrine. Twist on like this. Same thing. You check, make sure it's epinephrine. Check the expiration date, which is June 2014. Clean the top off. Pull back to 0.4. Same thing. These tend to take a little bit more air. So if you pull back slowly, you don't get as much. And you might want to pull back, you know, to about 0.5. Same thing with this, and up to 0.4. Cap it. Okay, now that you've had those done, you want to go and look for a vein. Where you should start in the hand. What we've learned is they want you to start them either in the hand or they prefer, or the antecubital, which is what, you know, you really would do in practice. These veins right here look great, but in practice you really don't start IVs on the inside of the arm much. So you'll look, supposedly you have 4 tries. If you miss in the hand, you can go up and the veins in the antecubital are a little bigger. But you should always start distal and move up. So this one here, that looks like a nice big one, so I'll use that. Then you come back after you pick your vein and you put the butterfly on, oops, see, you don't want to get this mixed up. This is the epinephrine. You do not want to give it IV. You'd have a very sick patient. Take the fluorescein, twist the top up, and you don't want to put it down. This would go right in the sharps. Twist the pink off, and just twist them together. So then your fluoresceint's ready. Okay, then you're going to put the tourniquet on. The site I picked was down in the hand, so you want the tourniquet right about here, about 3 inches above. If you're using the antecubital, you'll want it up in the, about 3 inches above. So you want to tie this pretty tight. And also you'll ask the patient to open and close their fists to make the veins bulge out a little more. You'll also go over some of the signs of an allergic reaction in case they do have an allergic reaction to the dye. So you just say to them, let me know if you feel any shortness of breath, itching, flushed feeling, and you know that could mean that you're having an allergic reaction. Then you put your gloves on.
Determine your size glove now, okay? Because it can be a real pain.
You don't want it big.
You don't want it too big.
And you want to know which way where the thumb is. Alright. We're pretending this is alcohol. So you clean the spot off that you picked, and you do that in to out like a bullseye. Once you clean this, you don't want to go back and palpate because you'd be contaminating the site. Okay, you want to insert this, bevel up. Okay, it's a slant, you'll see. You want to put your non-dominant hand below where you're inserting. You don't want to insert it with your hand up there because you may stick yourself. So you're going to pull back, insert it about 30 degrees, and then level out. Now you're going to check. You're going to pull back. It'll be easier when you're in there. They're going to be using red dye. So you'll see you want to pull back to the top of the hub. Alright? All of that is air before then, so the blood will displace the air. And, okay, so that's done. Then you undo the tourniquet. You'll hold the syringe up this way. That way the air that was in here is at the top. If you hold it this way, the air is up here and you'd inject it right in. So you inject slowly. You watch the top of where the needle's inserted for any swelling, a bubble. They complain of a lot of pain. It could mean the needles become dislodged and the medication is going into the tissue surrounding.
So at that point, they want you to say, I think it's one of the steps, I'm checking now for extravagance as I'm giving the appears
say
to be none.
What those signs are,
right, and
which is the
sign.
bubbling. Okay, so you cover that, pull this, and that would go right into the sharks, but we saved it. Then you get your tape, and it's done. Then you would document that you gave 3 cc's of fluorescein IV in the left hand, and date and time. Okay, now if they were having an allergic reaction, or to give it any IM medication. You inspect the skin, make sure there aren't any breaks in the skin, any nodules. Clean it off the same way, in to out. I like to squeeze the muscle, or you can spread the skin. Dart it in, pull back, make sure you are not in, you don't want a blood return. You don't want to be.
The other one you wanted, in this case,
Then inject it, get a 4x4, that goes right in the sharps. You massage the muscle a bit to disperse the medication, and then same thing. And you would document that you gave 0.4 cc's epinephrine IM in the left deltoid, and the date and time.
How are we documenting this?
No, you're just
saying
you're
it out
just
loud.
saying it out
Okay.
loud what you would be doing.
And then to take your gloves off, you pull one off, and then put the other in. And that's that.
We have 3 stations set up, so